Your professional values are the standards that guide your behavior as a nurse. Values are a person's beliefs about what's important or what matters most to them. They can be just about anything, such as family, hard work, success, or even having a good time. Sometimes, people lose sight of their values. They live their life in a way that's incongruent with what they believe. For example, someone who values family might become overwhelmed by work and then neglect their relationships. Professional nursing values are defined as important professional nursing principles of human dignity, integrity, altruism, and justice that serve as a framework for standards, professional practice, and evaluation. Human dignity. The English word dignity comes from the Latin word dignitas, which means worthiness. Dignity implies that each person is worthy of honor and respect for who they are, not just for what they can do. In other words, human dignity cannot be earned and cannot be taken away. Dignity is concerned with how people feel, think, and behave in relation to the worth or value of themselves and others. To treat someone with dignity is to treat them as being of worth in a way that is respectful of them as valued individuals. Altruism. Altruism is concern for the welfare and well-being of others. In professional practice, altruism is reflected by the nurse's concern and advocacy for the welfare of patients, other nurses, and healthcare providers. When we turn to altruism and its praxis, we find that it supports proper nursing. Most other ideals, such as the idea of doing a good job or loyalty to a code of ethics, put something else ahead of the patient's overall well-being. With altruism, the patient's well-being is the most important factor. Justice. The principle of justice states that there should be an element of fairness in all medical decisions. Fairness in decisions that burden and benefit, as well as equal distribution of scarce resources and new treatments, and for medical practitioners to uphold applicable laws and legislation when making choices. Caring. A culture of caring as a fundamental part of the nursing profession characterizes our concern and consideration for the whole person, our commitment to the common good, and our outreach to those who are vulnerable. Integrity. A culture of integrity is evident when principles of open communication, ethical decision-making, and humility are encouraged, expected, and demonstrated consistently. Not only is doing the right thing simply how we do business, but our actions reveal our commitment to truth-telling and to how we always see ourselves from the perspective of others in a larger community. Diversity. A culture of inclusive excellence encompasses many identities, influenced by the intersections of race, ethnicity, gender, sexual orientation, socio-economic status, age, physical abilities, religious and political beliefs, or other ideologies. It also addresses behaviors across academic and health enterprises. Differences affect innovation, so we must work to understand both ourselves and one another. And by acknowledging the legitimacy of all of us, we move beyond tolerance to celebrating the richness that differences bring forth. Excellence. A culture of excellence reflects a commitment to continuous growth, improvement, and understanding. It's a culture where transformation is embraced, and the status quo and mediocrity are not tolerated. If you value inherent human dignity in your nursing practice, you choose freely to believe in the worth and uniqueness of each person, to realize that you have other options. For example, you could treat with dignity only those people who are most like you. And Furthermore, to believe that respecting each person's human dignity yields the best consequences for you and for all of society. Now that we have a basis of understanding of what value means in nursing and healthcare, let's look at some ethical principles. We will come back to this later in this semester and dive into some ethical dilemmas in greater detail, but for now, let's start thinking about some of these principles in a basic sense. We already covered justice, so I'll just focus on the others for now. Autonomy. Autonomy refers to the ability to act according to one's knowledge and judgment, providing nursing care with the full scope of practice as defined by existing professional, regulatory, and organizational rules. When it comes to our patients, autonomy means that individuals have a right to self-determination, that is, to make decisions about their lives without interference from others. For example, if a patient chooses not to receive a medication or treatment, that is completely acceptable, and they have a right to that. As professional nurses, we might not agree, but we must allow the patient to make their own decisions. Now, with that said, we can certainly ask if they would prefer to have more information or alternative choices. Beneficence. Beneficence is defined as mercy, kindness, and charity. The federal government takes this definition further in the Belmont Report. Here, beneficence means two things: refraining from maltreatment and maximizing potential benefits to patients while minimizing potential harm. In practice, nursing beneficence takes on many different forms. Examples might include resuscitating a drowning victim, providing pain medication as soon as possible to an injured patient in the emergency room, lifting side rails on a patient's hospital bed to prevent falls, providing vaccinations, performing daily tasks for patients who are unable to carry them out alone. Beneficence is valuable because it encourages a superior standard of nursing performance. It also emphasizes compassionate care and advocates for continual striving towards excellence. Nurses must be wary, however, of the downside of this principle, as it can lead to paternalism when executed improperly. When a patient's autonomy is sacrificed for providing care that is deemed right, acting in the name of beneficence, it can be damaging rather than helpful. For example, if a patient denies a certain treatment on religious grounds and a nurse decides to provide it anyway, the nurse has taken away the patient's autonomy. Although the nurse may have saved the patient in one way, the nurse has taken away the patient's clearly defined right to choose his or her own course of treatment. Veracity means being truthful, trustworthy, and accurate in all interactions with others. Now, this seems straightforward, yes. Well, we will come back to this with some case studies to explore. It's not always easy to do. Most of us associate a lie with a blatant and obvious untruth. However, we lie in many different ways, also in our daily lives. And the interesting part is we usually don't even realize that we're actually being untruthful until we sit down and think about it. We normally see ourselves as good because we tend to judge ourselves by our honest intentions. For example, think about this. A good example of an actual lie in the nursing situation is when we tell a patient or their relatives that they're going to be fine, when we know that they will probably not survive the night. Then there are the small white lies we tell to be tactful or to save the patient from concern, the ones we feel are in the best interests of the patient and can't do any harm, or the ones we use to cover up, like when we've made a mistake. But if we are found out, these lies can cause us to lose credibility and destroy the relationship of trust that we have with our patients. And then there are the lies of omission, leaving out important information in order to conceal the whole truth, promising to do something just to ease a situation while knowing that you don't intend to keep the promise is also a form of lying. So is spreading rumors, sharing things about other people that you don't know for sure are true. Misleading another person through lies twists their own reality. Broken trust can hurt relationships permanently, and it can also affect your own reputation. Dishonesty could even cost you your career. Sometimes nurses feel like they have to tell a little white lie or bend the truth to spare a patient from unnecessary anxiety. Have you ever told a patient before a procedure that it won't hurt? Or that they'll be running around in no time when you know they'll probably take months to recover? Or suppose I'm teaching a student how to insert IVs. The patient may ask, fearfully, of the nurse I'm teaching, "Have you ever done this before?" I believe that an honest answer would serve no purpose in this situation. I would likely answer, "Oh, we can't count how many times he or she has performed this procedure." But where do you draw the line? Is rationalizing blurring the line of veracity okay to do? Convenience can be a trap. Fidelity in nursing means that nurses must be faithful to the promises they made as professionals to provide competent, quality care to their patients. Nurses are encouraged to keep their commitments based on their virtue of caring. An example of fidelity: a patient requests that a nurse not reveal his terminal diagnosis to his family. The patient explains that his family would probably disregard his wishes and keep him alive no matter the circumstances. What do you do? What about when you make a promise to a patient to be back in an hour to check on them, but then a code happens down the hall on a patient that isn't yours, but you're asked to help? What then? Non-maleficence. This means doing no harm, whether intentionally or unintentionally. Nurses must provide a standard of care which avoiding risk or minimizing it as it relates to medical competence. An example of nurses demonstrating this principle includes avoiding negligent care of a patient. Born out of the Hippocratic Oath, this principle dictates that we do not cause injury to our patients. The principle of non-maleficence is considered before new treatment approaches are tried on patients. We ask ourselves, and then patients and families ask us, can this harm the patient? Together, these principles offer ample benefits to the field. The principles correspond to values that are a part of American life, so they are familiar to everyone. The principles are both useful and specific. The principles can transcend practice areas and can be applied to both bioethics and clinical ethics. But for all their benefits, the principles are not without challenges. Conflicts between principles can and do occur. An example might be a cancer patient refusing treatment. How can a nurse respect the autonomy of the individual while ensuring the patient still receives life-saving care? Resolving conflicts between these principles is really difficult, and solutions are rarely black and white. While these principles are meant as a guide, it is up to nurses themselves to find the ethically appropriate solutions to the problems they face. Ultimately, adhering to defined ethical principles helps nurses provide exceptional care throughout their careers. A deeper understanding of these principles is a crucial tool for success. Finally, let's talk about professional boundaries. The nurse must always maintain professional boundaries with patients and colleagues to prevent misunderstandings and inappropriate relationships. Violations of professional boundaries may result in loss of employment and licensure and civil action, depending on the severity of violation. This is one of the reasons I do not give out my personal cell phone number to students, nor allow social media connections between me and my students. Issues of professional boundaries include receiving or giving gifts. The nurse should decline all personal gifts and should avoid giving personal gifts to patients because either can set up expectations about a relationship that are not realistic. Coercing patients. Forcing a patient to do something against the patient's will, such as have a treatment, or intimidating a patient into cooperating, not only breaches professional boundaries, but may be perceived as assault. Showing favoritism. Giving more attention to one patient than others or doing favors for a patient may indicate overinvestment in a patient and may develop dependence on the part of the patient. The nurse, who is in a position of power and authority, should avoid beginning a personal relationship with a patient. Sharing personal information. The nurse must maintain a professional distance in terms of sharing and must avoid sharing personal information that would normally share with family or friends, as the patient may believe this constitutes a more personal relationship than the nurse intended. Using social media. The nurse must always be familiar with the institution's policies about social media, as they may be very restrictive in relation to what a nurse can post regarding employment. From a practical perspective, it's usually best to post nothing about work, the work environment, patients, or colleagues. The patient's rights to privacy and confidentiality extend to social media. So if the nurse posts a picture or the name or condition of a patient, this is the violation of HIPAA. Posting negative comments about coworkers is not only unethical, but may be construed as lateral violence and bullying. Additionally, posting information that might suggest the nurse has questionable moral character, such as pictures or stories of engaging in promiscuous sexual activity, nudity, drinking, or drug taking, may result in loss of employment or even loss of your license. Professional boundaries are the spaces between the nurse's power and the patient's vulnerability. The power of the nurse comes from the nurse's professional position and access to sensitive personal information. The difference in personal information the nurse knows about the patient versus personal information the patient knows about the nurse creates an imbalance in the nurse-patient relationship. Nurses should make every effort to respect the power imbalance and ensure a patient-centered relationship.